You have a splitting headache. You walk into the doctor's office. He takes one look at you, picks up a sharp stone tool, and starts drilling a hole into your skull. No painkillers, no anesthesia, no sleep. You are completely awake for all of it. And when it is over, he tells you that you are cured. Welcome to 5000 BCE, where this was not a horror story. This was medicine. This procedure had a name. It was called trepanation, and it is the oldest surgical operation ever discovered in human history. Stay until the end, because the survival rate of this surgery is going to completely shock you. Trepanation is the act of drilling, cutting, or scraping a hole through the human skull while the person is still alive. And this was not some rare, isolated practice from one ancient tribe. Archaeologists have found trepanned skulls on every single continent on Earth. Europe, Africa, South America, Asia, the Pacific Islands. Everywhere humans settled, they were drilling into skulls. The oldest confirmed trepanned skull ever found is approximately 7,000 years old, discovered in France. But some researchers believe the practice may go back even further, possibly 10,000 years. Think about what that means. Before the wheel, before writing, before any metal tools existed, humans were already performing brain surgery. But here is what is going to genuinely shock you. These patients did not all die on the table. Many of them survived, and we know this because of one very specific piece of evidence left behind in the bones. When bone is cut or drilled, if the person survives, the body begins to heal around the wound. New bone grows at the edges. Archaeologists have found skull after skull with clear signs of bone regrowth around the hole, meaning the patient lived for weeks, months, sometimes years after the procedure. One skull found in France had 5 separate trepanation holes and showed regrowth around every single one of them. That person survived the surgery 5 times. So why were ancient people drilling into each other's skulls? The reasons depended on the era and the culture. They fall into 2 broad categories. The first reason was spiritual. Ancient people believed that headaches, epilepsy, mental illness, and strange behavior were caused by evil spirits trapped inside the skull. The logic was simple and terrifying. If there is something bad inside the head, you make a door and let it out. The hole in the skull was not meant to hurt the patient. It was meant to give the demon an exit. The second reason was surprisingly practical. Head injuries from warfare, falls, and hunting were common in ancient life. A severe blow to the head could cause a blood clot to press against the brain, creating unbearable pressure, seizures, and death. By cutting a hole in the skull, the surgeon could relieve that pressure. And occasionally, it actually worked. Now let us talk about the part nobody wants to think about, how exactly they did this. In the Stone Age, surgeons used sharpened flint or obsidian blades. Later cultures used copper tools. Some used bow drills, the same spinning tool used to start fires, but with a sharpened bone or stone tip pressed against the skull. The most common technique was called scraping. The surgeon would scrape the surface of the skull repeatedly with a sharp stone until they wore through the bone layer by layer. This was slow, this was painful, and the patient had to stay completely still throughout. A second technique involved cutting a series of grooves into the skull in a square or circular pattern, then popping the piece of bone out like a tile. A third method used a twisting drilling motion, essentially boring through the skull, the way a carpenter bores through wood. No anesthesia existed in the modern sense. Some researchers believe certain plants, like alcohol-fermented drinks or herbs with sedative properties, may have been used to dull the pain slightly. But fundamentally, the patient was awake, aware, and had to endure every second of it. Before we go further, if this kind of weird, fascinating history is what you are here for, hit subscribe right now. We do this every week, and it only gets stranger from here. Who was actually performing this surgery? In most ancient cultures, trepanation was performed by a shaman, a healer, or a medicine man, the most respected and feared person in the community. This was not a back alley procedure. This required skill, knowledge, and practice. Archaeologists believe some ancient surgeons practiced their technique on animal skulls before ever touching a human patient. Evidence from ancient Peru suggests that some Incan surgeons had success rates as high as 80 to 90%. That is extraordinary, especially when you consider that surgeons in 19th century Europe, working with metal instruments and significantly more knowledge, had trepanation survival rates that were often lower. The Incan surgeons were cleaner, they worked carefully. They likely kept wounds clear and did not leave tools inside the body. In a cruel historical irony, the introduction of European surgical instruments sometimes made outcomes worse, not better. Now, here is the detail that stops everyone cold when they first hear it. Some of those ancient skulls show not just one healed hole, not just two. Some show 3, 4, 5 separate trepanation wounds, all healed. This means the same person sat through this surgery multiple times and survived each time. We do not know if they volunteered. We do not know if they were brought back against their will. We do not know if they believed it was helping them. What we know is that they lived. Let us look at some specific cases. In 2018, a 3,000-year-old skull was discovered in Israel, with a large rectangular hole cut cleanly into the top. The edges showed clear signs of healing, meaning the patient survived for a significant period after surgery. In South America, archaeologists found dozens of trepanned skulls near ancient battlefield sites. The pattern was consistent. Head trauma, followed by surgical intervention, followed in many cases by recovery. In ancient Russia, a 7,000-year-old skull was found with a hole so cleanly cut that researchers initially thought it might be from a modern tool. It was not. It was stone. In medieval Europe, trepanation continued to be practiced well into the 1600s, long after doctors should have known better. Kings and noblemen paid large sums to have their skulls drilled for headaches, depression, and what we today would call anxiety disorders. Here's the part that brings it all home. Trepanation never actually disappeared. Today, neurosurgeons perform a procedure called a craniotomy, where a section of the skull is temporarily removed to access the brain, relieve pressure, or remove tumors. The principle is identical to what ancient surgeons were doing 7,000 years ago. The tools are different. The knowledge is infinitely deeper. The patient is anesthetized and safe, but the fundamental idea, cut a hole in the skull to fix what is happening inside, that idea is ancient. The next time you hear about a neurosurgeon saving someone's life, know that the first version of that surgery was performed by someone crouching in a cave with a sharp piece of flint. So, here is what we know. Trepanation is at least 7,000 years old. It was practiced on every continent. Patients survived it, sometimes multiple times. Ancient surgeons in Peru achieved success rates that rival 19th century Europe. And the core procedure is still performed today in hospitals around the world. The human body has always needed help, and humans have always been brave or desperate enough to try. If this video changed how you think about ancient medicine, leave a comment below. Tell me what surprised you most. And if you want more stories like this, where history is stranger and more impressive than anything you learned in school, subscribe. New video every week. See you there. Think modern medicine is strange? Wait until you see the treatment doctors trusted for over 2,000 years. Watch the full video now and discover the shocking history of bloodletting.